Hello all, our project is about sepsis, which is a blood infection related disease and that can cause humans to death. And we mainly focus on sepsis due to uh, lack of sepsis detect sepsis awareness in people. So we mainly focus on sepsis detection in ICU patients since it can help a lot to the ICU patients and can save their lives. And our project is about a machine learning model of the accurate prediction of sepsis in ICU patients. And sepsis what refers to septemia, which is a blood infection disease that can cause humans to death. And this is our front-end part of the website. And as we can go to the website, just we can look into the introduction of sepsis. According to World Health Organization, sepsis is potentially a life-threatening disease, threatening organ dysfunction caused by dysregulated host response to infection. And the symptoms of sepsis are the general symptoms are a fever above 101, 101 degree centigrade, and the temperature below 96.82 refers to sepsis symptom, and the heart rate higher than 90 beats per minute, breathing rate higher than 20 beats per minute, and a confirmed infection. And the severe symptoms of this sepsis are patches of discolored skin, decreases urination, changes in mental ability, problems in breathing, and the causes of sepsis are kidney infection, abdominal infection, meningitis, bloodstream infection, pneumonia, and cellulitis. And we can treat the sepsis through, sepsis through medication, supportive care, and surgery. Since we look into the medications, there are three types, which is antibiotics, intravenous fluids, and vaporizers. Antibiotics treated with antibiotics should begin immediately. Initially, you will receive broad spectrum antibiotics which are effective against various of bacteria. The antibiotics are administered intravenously. After learning the results of blood test, your doctor may switch to different antibiotics that is targeted to fight to the particular bacteria that causes infection. And intravenous fluids, people who have sepsis of receive intravenous fluids right away, usually within 3 hours. And as per this, if your blood pressure remains too low after receiving intravenous fluids, you may be given a aspirator medication which contracts blood vessels and helps to increase blood pressure. And surgery may be needed to remove sources of infection such as pus and infected tissues or gangrene. Sometimes treatment in an intensive care unit is also needed. And the main precautions of sepsis are getting vaccinated, clean skin wounds promptly, treat urinary tract infections promptly, and other. This is what the gallery that describes about the sepsis, and we can look into the pictures of sepsis, which is maybe various kinds. And this is our front end part of the website. And after clicking the button predict sepsis, we will be moving to this page. Here we will be calculating SOFA score. SOFA is nothing but sequential organ failure assessment score. Based on that only we will be calculating whether the person is getting affected by sepsis or not. When we click let's start, we will be giving patient details like 1, 2, 3, 4, and the first name is something X, and the last name is NSHS, and we will be giving age as 21. When we click start prediction, it will be getting this. We will be getting a pop-up window of sofa score and sofa score. Based on this pop-up window, we will be calculating the sepsis. This is what the page in which we will be adding the adding the values of patient which he gets from the hospital medical reports, and we will be calculating low BP, high BP, saturation, respiratory rate, heart rate, temperature, respiratory system, kidney function, liver, and coagulation. And based on that patient's medical records, we will be incorporating the values which he gets from medical reports. And after that we will be getting predict now. When we click the predict now, we will be getting a pop-up window like such is detected or not, and the sofa and QSOFA scores. And this is what our output. And when we move to the home screen, we will be having a login in which admin only can be used to log into it. And after signing, we will be getting the data, and we will be storing the data. This is what the name we have given, and we will be getting as sepsis not detected. Somehow, if we go somewhat up and we can see now, then we will be getting various results like sepsis detected with high risk, or here the SOFA score is 3 and QSOFA score is 2, and it detects a high risk and sepsis 2 detected. If SOFA score and QSOFA score is 1, then we will be getting low risk. This is what our output. Thank you. And we have used languages like Python and Python framework of Flask for its backend work, and we will be using machine learning algorithms like logistic regression, random forest classifier, and other things. And this is how our project executes. We will be going to the particular backend file, and after that we will be giving a command named pip install hyphen r re2.txt, which will automatically downloads our necessary libraries. And after that we will be giving python space app.py as a command, which will be giving as a particular deployment server, and it will be uh, redirecting to this page. And and this is how we will be doing our project.